welcome back. I am joined by Dr. Botsile Kuiperij. Is that correct?
Kuiperij.
Kuiperij. Oh gosh. I really can't say it, hey? Do you have a problem with that most of the time? Like people not being able
All
to...
the time.
I'm so sorry I had to be one of them. I'm sorry, but I'm going to do better. But she is one of the organizers of this wonderful event that we're talking about revitalizing clinical concepts, right? So please do tell us what inspired this whole conference.
Oh yes.
Yeah.
So we're talking revitalizing the dental industry.
Yes.
And basically this idea started in April 2022. There was a time when after COVID hit, dentists were just depressed because we were very hard hit. At some point we weren't even practicing. And then of course you can imagine people had toothaches and couldn't have access to go and see dentists. So this idea came because we felt like we need to bring back the joy of practicing dentistry. So we organized our first event last year, May, and it was revitalizing the dental industry, and we touched on areas that mental health, financing dentistry, and then of course the different areas in dentistry, practicing dentistry, because we just wanted to uplift the spirits of the dentists and to keep practicing and keep providing the service of taking care of people's mouths. And then of course this year, it's still revitalizing the dental industry, but we're talking clinical concepts. So clinical concepts as in practice. You know, what are we doing for our clients? How can we better serve our clients? Because what's happening with dentistry is the world is becoming digitalized, and dentistry as well. And doing dentistry, you need to learn. You can't be left behind. You know, you can't be left in the ages where everything was analog and it took forever. For example, nowadays you can deliver a crown on the same day. And all these years, it would take 2 weeks. So we wanted to bring ourselves to the level of the international standard, basically, as service providers in the dental industry. And then, of course, we just want to educate, generally, professionals that provide oral health care. It's important because, you know, you always want to serve your clients better. And like I said, you have to keep up to date. Also, our clients also have information. They're going on the internet, they're learning. You know, they come to you and they have an idea. You know, they'll tell you what they want, basically. So we also need to be able to step up and match that.
You are a dentist by profession, correct?
Yes.
Yeah, so please do also tell us about that. 13 years of experience. that's a lot. So please do tell us about that as well.
Yes. Yeah. So I graduated in 2011 as a dentist from Trinidad and Tobago, University of the West Indies.
Wowza.
And then, pardon me?
Wowza. It's a Gen Z thing.
And then,
yeah.
Oh yes, I got lost for a minute there. And then after I graduated, I actually did my internship there in Trinidad and Tobago, and then I came back home. And then for 6 years, I worked at Princess Marina Hospital, which is a government facility, and 3 years at Ganya DHMT, and the rest of my time I've been practicing in private practice. So my experience in government and private practice has been very different. So practicing in the government sector, basically we used to see a lot of clients that only came to see the dentist when they were in pain. So we then realized that there's a lot of education that needs to go out to the public, because basically what needs to happen is people need to go to the dentist just for a general checkup every 6 months, but people don't know that. So that's why we felt as Vogue, part of our mandate is just to go out to the public and educate the public and tell them that, you know, you have to see a dentist. This is by the World Dental Federation standards. It's advisable to see a dentist every 6 months, because when you see a dentist every 6 months, if at all there's any oral disease, it can be picked up early and intervention can be early. Even if there's nothing, you get the education to know how to take care of your mouth so that you don't develop any oral diseases. And let me break down oral diseases. We're talking your dental caries, dental decay, your gum disease, your oral cancer, these are preventable diseases. I know they're non-communicable diseases, and when I throw in that word, non-communicable diseases, for a lot of people, what comes to mind is your hypertension, your diabetes. But dental decay, which causes pain, gum disease, which causes red bleeding gums, those are preventable diseases. Also oral cancer, which is potentially deadly, somewhat preventable. So like I was saying, we need to educate the public that come to see the dentist, get the information. Know how to take care of your mouth so that you don't develop these diseases.
Yeah.
Yes.
I see it also as like a linking tool. You know, we talk about oral cancer because oral cancer, can we actually just touch on that very quickly for the viewers to understand what exactly causes oral cancer? Because we're talking cancer that can be, like you're saying, deadly. You spoke about how it can, you know, go to the neck, the lungs, and you can't breathe, and then all these things. So please, can you just explain to us very quickly what causes oral cancer?
Right. So oral cancer, that is cancer that affects parts of the oral cavity, the mouth, right? It could be cancer on the lips, it could be cancer under the tongue, on the tongue, back of the throat, or inside your mouth on the cheeks. Now, what causes it? The risk factors for oral cancer is smoking, drinking alcohol, and sometimes you can be genetically predisposed. For example, if there's cancer in your family, then you may be at a higher risk of developing cancer. So with things like smoking and alcohol, the chemicals in your cigarettes, you know, your tobacco, even if you chew tobacco, your cigars, your vapes, they're chemicals that when they come into contact with the soft tissues in your mouth, can actually cause the cells to change such that you develop cancer. So it's actually, so those are the risk factors, like I said. So it's advisable we always advise our clients to try to stop smoking. Even if they've been doing it for many years, it's always advisable to stop. And with alcohol, there are recommended daily allowances for women and men. You don't want to see yourself exceeding that, because by doing that, it puts you in a position of potentially developing oral cancer. And the thing about oral cancer is, going back to how we encourage people to come to the dentist every 6 months, when you see a dentist regularly, every time they look in your mouth, those are some of the things that they check for. You know, is there a sore in your mouth that has been there for a long time and it's just not going away? So if it's there, we will see it, and we are able to say, oh, this is just your tooth rubbing on your cheek, or this is suspicious, so let's investigate further. And by so doing, we're able to catch it early. And just like any other cancer, for example, breast cancer or cervical cancer, when caught early, it can actually be cured. Yes.
No, go on. Yeah.
And then, of course, if say, for example, you're not a regular attendant to the dentist, and cancer is not painful. You may get to a point where now it's grown, it's starting to spread, and now it's painful. And then when you come to the dentist, it's you know, the
Fully
interventions,
now, I
are
do
more
get
complex and more expensive, and you're already in a state where it's painful and possibly has spread to other areas of your body.
Fantastic. Thank you so much for that, Dr. Botsile. Thank you for joining me and Career Forum. We are super excited, and thank you so much for this conference as well. I do think it's very educational to even us, you know, who are not dentists. We just get to know, you know, like you're saying, I've taken a lot from this conversation to say that, you know, 6 months, every 6 months, I have an orthodontist and I haven't been there in a while.
Oh my.
So I need to make sure I go back there after this. But thank you so much for joining us.
Thank you for having me. Thank you so much.